Hello and welcome. Dr. Andy Rosenfarb here with Acuvision Acupuncture. Can't talk today. So today I want to talk to you guys about optimizing optic nerve health. So optic nerve health is an issue for a lot of people, and you can have a lot of diseases that arise from degeneration of optic nerve health and function. So we're going to talk about 8 main diseases of the optic nerve. There's quite a few, but there's 8 main ones that I want you guys to know about. Then we're going to talk about what causes them, and then we're going to talk about how to treat them. So stick around. This is going to be really important for you, especially if you or somebody you know is dealing with an optic nerve issue. So let's start. So for those of you guys who don't know, you probably may know this, the optic nerve is a critical part of the visual system. It's part of the entire visual system. It's responsible for transmitting the visual information from the eye, specifically the retina, to the brain, more specifically the visual cortex. So it's the nerve that connects the eyeball with the brain. So we call the visual system is the eye itself, the optic nerve, and the brain. Specifically the visual cortex, also to some degree the front of the brain, the prefrontal cortex. So there are a lot of conditions that can arise when we're talking about optic nerve health, optic nerve degeneration. So the first thing we want to talk about, or the first condition rather, is optic neuritis. All right, neuritis. Anytime you see itis at the end of a word, that usually means inflammation. So optic neuritis means inflammation of the optic nerve, which is often associated with infections, autoimmune conditions, and demyelination of like multiple sclerosis, where the sheaths of the nerves break down and are degenerated as a result of autoimmune conditions like MS or other types of infections or conditions in the body that accelerate this breakdown of the myelin sheaths, resulting in optic neuritis. Anything that metabolic, microbial, autoimmune, infectious, that creates this inflammatory process, and you can see it when your eye doctor will look at the back of your eye. You'll look at it, it'll look pretty red and inflamed. So optic neuritis is the first situation with the optic nerve dysfunction that we see. And again, symptoms may include things like sudden vision loss. Sometimes you'll have pain with movement, visual field deficiencies, either to the side, to the top, to the bottom, or patchiness all over the area. Is the optic nerve fibers become inflamed and start to either get damaged, or they can even go dormant, or they even start to break down and die. So optic neuritis is a real big deal, again, associated with inflammation. The second condition is glaucoma, right? We've talked a lot about glaucoma, very, very common condition. A lot of people deal with it. The main conditions we look at with glaucoma, of course, are primary open-angle glaucoma. There's also angle closure, which is more of a medical emergency. We don't really see much of that as clinic. That's when your eye pressure spikes because the angle closes and the aqueous fluid can't release from the eye. You don't have that drainage system, or there's a hyperproduction. Either or case, the pressure increases to a degree that can put substantial and significant pressure on the optic nerve. Then you also have conditions like normal tension glaucoma, which is often autoimmune, pigmentary glaucoma, and of course pseudoexfoliation glaucoma. So you may have heard one or more of these. Again, the most common I see in clinic is primary open-angle glaucoma. That's the condition that's usually treated with eye drops or a trabeculectomy, shunt sometimes to release the pressure. The whole strategy over there is to manage the pressure. When you're dealing with things like normal tension glaucoma, often glaucoma specialists will still provide, recommend, and prescribe eye drops, but since the pressure is normal, that's not really an issue for these people. So that's the second, glaucoma. The third condition related to optic nerve issues is ischemic optic neuropathies. All right. So these ischemias that happen, they're caused by insufficient blood supply. All right, they're caused by a blockage either like a blood clot or plaque or cholesterol that builds up inside the blood vessels, so you don't have proper blood flow and oxygenation to the optic nerve itself. So you can have either an AION, which is an anterior optic nerve, optic neuropathy, or you can have a PION, a posterior optic nerve issue. One of the more common conditions we see in clinic are NAION, which is a non-arteritic anterior optic neuropathy. So this is an eye stroke that people have, often caused by stress and sleep apnea. Those are the two biggest things that I've seen that really drive NAION. If you're really interested in that specifically, I have a whole video. You can go to our YouTube page where I've done a specific video on NAION. It's very, very common. Unfortunately, it's becoming more common. I believe COVID accelerated that. Some folks have had it after they've been vaccinated, after they've gotten a COVID infection with the COVID virus. Also, a lot of patients I've treated, again, have had sleep apnea issues, either diagnosed or undiagnosed, and also a lot of stress. I have a lot of patients who've had a lot of stress on a lot of caffeine, a lot of alcohol, not eating right. Just mismanaged stress can create that too. And what happens basically is again, it's insufficient blood supply to the optic nerve, resulting in pallor. The optic nerve gets, again, what they call pallor, means that it turns pale as a result of the lack of blood flow. So that's the ischemic optic neuropathies. Fourth is optic atrophy. Okay, optic atrophy is a degeneration or loss of nerve tissue of the optic nerve. Often these are idiopathic, and what idiopathic means is the doctors just don't know what caused it. Like you go to your ophthalmologist, your optometrist, retinal specialist, glaucoma specialist, all these specialists, optic nerve specialists, and they're not really sure what caused it. Often there are autoimmune conditions or infections, sometimes traumas, but again, basically it's a degradation of the optic nerve. Can be a result of all kinds of conditions: glaucoma, optic neuritis, vascular disorders, meaning the blood vessels are clogged or breaking down and not delivering sufficient oxygen and blood supply to the optic nerve. And it leads to gradual decrease in vision. And again, the optic disc looks pale or pallor. That's the way we diagnose this. So again, this is often a condition that requires a little investigation to source it and find out what's going on. And we'll talk a little bit later. We have some really, really good treatments for idiopathic optic neuropathies. The fifth condition I'm going to bring up and mention, it's not as common because it's a little bit more of a medical emergency. It's called Papilledema. It's a swelling of the optic nerve head due to intracranial pressure, often associated with conditions like intracranial tumors, meningitis, hydrocephalus, which is water on the brain. So we see this, it's more as a result of something else going on in the body. And what you'll, patients or individuals who are dealing with this will usually see blurry vision, which can lead to optic nerve atrophy if not treated. So it's really important to diagnose that, especially if any of those conditions are going on. Again, like meningitis or any benign tumors, they can really put pressure on there. The seventh of 8 that we want to talk about is hereditary optic neuropathies. Again, these are genetic, maybe it's in your family somewhere, where the genetic disorder affecting the optic nerve, again, which is usually autoimmune related in my experience. So these include conditions like Leber's, hereditary optic neuropathies, or autosomal dominant optic atrophy, again, or idiopathic. They're like, hey, we have optic nerve issues in the family, but we really don't know what drives it. Again, in my experience, there's usually an autoimmune component, sometimes vascular or metabolic. Like you could have a blood sugar dysregulation result in that as well. Often you'd see diabetic retinopathy with that, but you can also see diabetes and insulin resistance or dysglycemia affect the optic nerve. That's quite common. You can also see optic nerve drusen. That's getting more common, which is lesser known. So it's actually the drusen, which is the cholesterol, plaque, and protein that's usually associated with macular degeneration, but you could see that build up on the optic nerve. So we're really focusing on breaking down the drusen that's built up, or the cholesterol and protein. Finally, you can have traumatic optic injury, right? You can have an injury of the optic nerve causing a neuropathy, where damage to the optic nerve is due to like a head trauma or direct injury to the eye. Maybe it's a car accident or something like that. And the vision loss there, obviously, in those cases are usually immediate. They can develop over time, especially if it's like a concussion or something like that. Maybe it takes a couple days or a head injury for it to really see the effects of this. So those are our main condition associated with optic nerve issues. Most commonly in clinic, I'll see glaucoma. I will see multiple sclerosis, MS, optic neuropathies related to, or optic neuritis related to that. Definitely infections. Sometimes we'll see bacterial infections like ocular Lyme can inflame the optic nerve. All these host of conditions. The important thing here is your ophthalmologist will often just diagnose the optic nerve issue. It's usually either an atrophy or an inflammatory process. So they basically say you have optic neuritis or optic nerve atrophy or some type of optic nerve dysfunction that they're not really sure about. So these are cases that we do really well with. Why? Because it requires a sophisticated level of investigation, right? We have to investigate and put on our Sherlock Holmes hat and really find out what's going and audit your system. This is where we need to really go holistic. And holistic means we're looking at all the systems of your body to find out what's driving this. Yeah, your optic nerve's affected, but there could be larger factors or processes going on inside your body that we have to identify. So we will sometimes look for other tests. Maybe you want to do blood tests to look at your metabolism, look for diseases or infections. Maybe we'll look for inflammatory markers, autoimmune markers, infectious disease. So we'll look at, in addition to your ophthalmic visual testing, the imaging that's done in the functional testing, we want to take a whole body inventory or an audit of what's going on so that we can gain clarity, again, in terms of the underlying causes of your eye condition, in this case, your optic nerve issue. So treatment strategies are, which some of you guys may be familiar with, those of you guys who follow me, are the following. So we need to increase blood flow to the optic nerve. Again, as previously stated, a lot of these breakdowns of the optic nerve in terms of structure and function can be directly related to insufficient blood flow to the optic nerve, right? So we need to have really good blood flow to the optic nerve in order to allow it to function. These little cells need to respirate, right? They need to breathe like little miniature versions of us. They also need food. So the blood flow brings vital nutrients to the optic nerve for repair, regeneration, and functionality, right? So again, increasing blood flow will bring food, it will bring oxygen, it will also help with elimination of toxic metabolic waste products and carbon dioxide. The second treatment strategy is to manage inflammation, specifically in cases like optic neuritis, again, which is inflammation of the optic nerve. So if inflammation is happening, whether it's systemic or locally, we need to isolate that, identify where the inflammation is coming from, and then address it so that we can resolve it in order to protect as much of the optic nerve as possible in either a short-term acute situation or with long-term chronic inflammation. We also need to control oxidative stress, right? We talk a lot about this in terms of free radicals and reactive oxygen species having a tremendous stressful impact on the cells. In this case, again, specifically the optic nerve. When your optic nerve is overwhelmed by free radicals, it creates a process of oxidative stress, which is accelerated aging and will actually break down the structure of the optic nerve, rendering dysfunction and a degenerative process. So controlling oxidative stress is a huge part to our treatment strategy. The next treatment strategy is to improve overall mitochondrial function, meaning we have to really help out the mitochondria. All right, the mitochondria produce ATP energy, and when ATP energy is not produced, we lack the ki, or life force, or functionality of the optic nerve. It can't do its job of relaying impulses, nerve impulses from the retina to the brain, right? That connector, that wire connecting, the information is not being transmitted from the eye to the brain. So it's because it doesn't have the energy to do so. So the cells start to get tired and weak and just are too tired, and they don't have the capacity to relay that information. So that requires a certain amount of energy, which is, again, specific to the mitochondria and ATP production. And for more on that, we do have videos on mitochondrial function, oxidative stress, and all these specifics. So if you guys are interested in any of these specific treatment strategies, feel free, again, to go to my YouTube channel, and you can type in the search bar and look for these specific conditions. Finally, we talked a little about this earlier, is we want to identify the underlying factor or factors that are driving your condition, right? You have optic nerve atrophy, you have glaucoma, you have NAION, you have all these factors that show up as a disease process, but we need to take the time to look at what caused it, or what factor or factors are contributing to this, which often your eye doctors, ophthalmologists, glaucoma specialists, retinal specialists will overlook, because they don't really have much time to really dive into that. So this is why integrative care works best and produces the best clinical outcomes for you guys. All right, this is where we want to look at branch treatment to help your eye condition, your optic nerve, but we also have to do root treatment in terms of understanding and managing and dealing with the underlying causative factors. Makes sense, right? So now we know what these conditions are, what our strategy is, what's the plan? What are we actually going to do to try to help increase the blood flow, manage the inflammation, deal with oxidative stress, and help with dealing with these underlying factors? I'm glad you asked. So we have two ways that we treat it. All right, we have in-office, where patients come to our office and receive acupuncture, supplements. We do vision testing before patients start. We go through a series of treatment, usually 2 weeks for new patients, sometimes 1 week, and then we reevaluate and we look at your before and after test results, and we measure your improvement and continue to advise you based on what your individual or specific situation is and how we want to manage that. We also offer at-home treatment options, where that consists of usually a telehealth consultation with me, where patients will hop on with me for anywhere from 45 minutes to an hour and a half, depending on your situation. And we'll go over your case specifically in very, very detailed and very deeply. So we want to find out exactly what's going on with your condition. Again, all these factors that are driving it, where you at, so we can figure out what we can recover short-term and long-term and help prevent future vision loss. Very, very important. So we'll use telehealth consultation to achieve that. Then we'll look at things like the alternating current stimulation, or ACS 3000, which is specific for optic nerve health. So again, any of you guys dealing with optic nerve issues, the ACS 3000, which is alternating current stimulation, which is also called transorbital stimulation. There's a lot of research, mostly came out of Germany, on alternating current stimulation, transorbital stimulation for optic nerve issues. That's where most of this research started. We also are going to look at supplements. We're also going to talk about diet, and we're going to talk about eye exercises and lifestyle. All these things you can do to help deal with these underlying factors that are driving, and lifestyle factors that are driving your eye condition. So what supplements, all right? What supplements can be useful for optic nerve health? So the supplements I recommend from our website, Eye Health Institute, are the Total Vision MA48 formula, which is your primary eye food and eye protection formula. We have the Neurovision, which targets the brain and optic nerve itself. Then we have the Lipovision DHA, which is our supplements that are protective of the optic nerve, and they help regenerate. The fat inside the DHA helps the nerves to regenerate. Very, very important for that. Also, the hydrogen tablets. The hydrogen tablets are very, very important for managing oxidative stress. We talked about that earlier. Canavision is also very useful if there's inflammation going on. Canavision is our CBD product that we use for inflammation and neuroprotection. Finally, if there's an eye stroke like a NAION, we recommend a supplement called serapeptase, which helps break down the proteins that are causing the blood clots that are commonly associated with these types of strokes. So those are some supplement recommendations. Again, you can go to eyehealthinstitute.com website and you can click on the optic nerve condition, and that'll help give you some more guidance. And again, if you want more specifics about your case, feel free to reach out. We can explore either a telehealth at-home treatment option for you, or you may even want to come into clinic and explore that possibility of coming here to Westfield, New Jersey, and working with me and getting your optic nerve and eyes improved. And we do that. You know, that's our motto. We have with the at-home treatment, our motto there is 12 weeks to better vision, and in office it's 2 weeks to better vision. So those are that's what we offer you guys. With the other treatments we do in office, we do ophthalmic electroacupuncture, the microacupuncture 48 system, scalp acupuncture. We'll do laser acupuncture, often hyperbaric. We'll do, again, molecular hydrogen treatment, very intensive there for our patients. So we have all these systems and all these treatment protocols and regimens that we'll offer for you guys, all in order to help improve the health, function, integrity of your optic nerve. So very, very important that you guys understand that. If you guys have any questions and you guys are watching this on repeat, feel free to drop your comments in the questions or email. If you want to email, if this is a private situation for you or a family member, please feel free to reach out to me, either email, you can DM me, direct message me, you can call our office, you can text our office, however you want to get. Those guys who are telepathic, you can try that. So thank you guys for joining us today. This session was on optic nerve health. If you have any questions, please feel free to reach out to us. Enjoy the rest of your day. And again, I am Dr. Andy Rosenfarb with Acuvision Acupuncture, where your vision is our mission. Take care, guys. Bye-bye.